Tuberculosis. Structure of tuberculosis. Mycobacterium tuberculosis is non-motile and rod-shaped, 2 to 4 micrometers in length and 0.2 to 0.5 micrometers in width. The generation time of Mycobacterium tuberculosis is 15 to 20 hours. 60% of the cell wall is lipid, in particular mycolic acids, which are suspected to determine the virulence. Mycolic acids are hydrophobic and help determine the permeability of the cell surface. The cell also contains something known as the cord factor. The cord factor is what causes colonies of tuberculosis to grow in a serpentine-like fashion. Symptoms of tuberculosis. Bad cough that lasts 3 weeks. Pain in the chest. Coughing up blood. Weakness or fatigue. Weight loss. No appetite. Chills. Fever. Sweating at night. Transmission of tuberculosis. When people with TB in their lungs or throat cough, laugh, sneeze, sing, or even talk, the germs that cause TB may be spreading to the air. If another person breathes in these germs, there is a chance that they will become infected with tuberculosis. Repeated contact is usually required for the infection. There is a difference between being infected with TB and having TB disease. Someone who is infected with TB has the TB germs or bacteria in their body. The body's defense are protecting them from the germs and they are not sick. Someone with TB disease is sick and can spread the disease to other people. A person with TB disease needs to see a doctor as soon as possible. Reduction of tuberculosis. 5 stages of tuberculosis. Onset, 1 through 7 days. The bacteria is inhaled. Symbiosis, 7 through 21 days. If the bacteria does not get killed, then it reproduces. 3. Initial cautious necrosis, 14 to 21 days. Tuberculosis starts to develop when the bacteria slows down at reproducing. The bacteria can't reproduce anymore, but can live for a long time. 4. Interplay of tissue-damaging and macrophage-activating immune response, after 21 days. Macrophages surround the tubercle, but some may be inactive. Tuberculosis then uses it to reproduce, which causes it to grow. The tubercle can break off and spread around. 5. Liquefaction and cavity formation. The tubercles at what point will liquefy, which will make the disease spread faster. Only a small percent of people will get to this stage. Treatment of tuberculosis. Medications are the cornerstone of tuberculosis treatment, but treating TB takes much longer than treating other types of bacterial infections. With tuberculosis, you must take antibiotics for at least 6 to 9 months. The exact drug and length of treatment depend on your age, overall health, possible drug resistance, the form of TB, latent or active, and the infection location in the body. With appropriate antibiotic treatment, TB can be cured in most people. Successful treatment of TB depends on close cooperation between patients and healthcare providers. Treatment usually involves taking several antibiotic drugs for at least 6 months and sometimes for as long as 12 months. Resistance to antibiotics. People who do not take all the required medicines can become sick again and spread TB to others. Additionally, when people do not take all the prescribed medicines or skip times when they are supposed to take them, the TB bacteria evolve to outwit the TB antibiotics. Soon, those medicines no longer work against the disease. If this happens, the person now has drug-resistant TB. Additionally, some people with TB do not get better with treatment because their disease is caused by a strain of the TB bacterium that is already resistant to one or more of the standard TB drugs. Cure for tuberculosis. If you have active TB disease, your doctor will give you several antibiotics to treat the infection and to help prevent resistant bacteria from emerging in your body. You may be taking a combination of antibiotics that may include isoniazid, rifampin,
pyrazinamide, or ethambutol for 6 to 12 months.